I'm doing my head to toe. I've got PPE on, gloves and goggles. I've already gone through danger. So I'm going to start by checking the patient for med bracelets, her wrists and her ankles. Then move on to the head. I'm going to palpate the skull and look for anything unusual, any contusions, bruising, swelling. I'm looking for rigidness in the face and the cheeks. I'll look in the ears and nose for cerebral spinal fluid. I'll look behind the ears for battle signs, look for raccoon eyes, and if the patient's conscious, I'll check their pupils and look for symmetry in those. I'll then move on to the neck. I'll palpitate the neck, look for anything unusual, crunchiness. I'll also feel behind the neck and feel for pooling blood back there. I'll then expose the patient and palpitate the chest. While I'm palpitating the chest, I'm looking for abnormal breathing, symmetry in breathing, and anything unusual. After that, I'll move on to the abdomen, palpitate the abdomen again. I'm looking for distension, bruising, blood, any lacerations, anything unusual really. After that, I'll move on to the pelvis, looking for symmetry in the pelvis, no abnormal rolling of the. And I'm also looking for reflex to pain. After that, I would, if I was by myself, I would just, under the back, look for pooling blood and feel for any lacerations or anything abnormal. And then I'd wait to check the patient's back before transport. For right now, I'll just log roll the patient and check the spine for any abnormalities. Anything that looks unusual, and just palpitate the back, looking for any lacerations or anything. Then I'd move on to the upper extremities, palpitate them all the way down, looking for any broken bones, anything unusual, pulling blood, check capillary refill and radial pulses on both. After that, lower extremities, palpitate them all the way down. Look for any broken bones, anything unusual, blood, capillary refills, pedal pulses. If the patient was conscious, I would get them to I would check their motor skills by getting them to push against my hand up or push against my hand down.